Okay, so welcome everyone to this Tobacco Endgame webinar. I'm Coral Gartner and I'm the Director of the Centre of Research Excellence on Achieving the Tobacco Endgame, and I'm delighted to be hosting this presentation on advancing the tobacco endgame in Europe through joint actions. I'd like to start the webinar by acknowledging that I'm on the unceded lands of the Jagera and Turrbal peoples, and I acknowledge and pay respects to their ancestors and descendants who continue cultural and spiritual connection to country. I'd also like to affirm our research centre's commitment to diversity, equity and inclusion, and recognise that being inclusive of diverse perspectives and backgrounds strengthens our work and helps us to produce more meaningful outcomes. Our presenter today is Ms. Hanna Ollila, who is a Senior Specialist at the Finnish Institute for Health and Welfare and the Manager of the WHO FCTC Knowledge Hub on Surveillance. She has extensive experience in the development and evaluation of Finnish tobacco control initiatives. Hanna led the Tobacco Endgame work package in the JATC2 and participates in other joint actions that support the EU's tobacco-free generation goal. And today, Hanna will be telling us about this really important work program in Europe. If you have any questions for Hanna, please submit these to us through the Q&A function. So don't use the chat function, just use the Q&A one. And we'll cover all the questions at the end of the talk, but you can submit these questions at any time. And now I'd like to hand over the microphone to Hanna.
Thank you very much. I hope my screen is showing correct. If you hear any issues with the sound or anything, then just please let me know. But thank you so much for inviting me to present in this webinar. It's really a pleasure to be here. And in Helsinki, it's quite early morning, so I will say good morning to everybody, but also good afternoon and good evening to other places. So as Coral kindly introduced this presentation, let's hope the slide changes. Yes. Today I will be speaking about, first of all, what are these kind of joint actions? This is probably something that is not so familiar outside the European region as a project type. And then I will be focusing most of the presentation on the work that we did in this joint action on tobacco control 2, where we had a specific work package on tobacco endgame. I will be very briefly also presenting what we are planning to do as part of a new joint action where we focus more on forward-looking tobacco control measures and expand the work that we did on the joint action on tobacco control 2. And just to state that I don't have any competing interests. So to begin with, what are these kind of joint actions? This is a very specific funding mechanism under the EU Health Programme. This type of a direct grant to the EU member states and associated partners has been running since 2008. And it is different from the research grants that are also available from the EU, but as this is really intended to promote the collaboration. So this is a really strong focus in these joint actions. So collaboration between the EU member states and also the Commission, and to really address key EU health policy priorities. So this is also kind of a political emphasis on where the direct grants are given. So these are really addressing the priorities established by the different commissions for the coming years. And the working methods usually include like sharing, testing and refining already existing tools and good practices, best practices, methods and approaches, but also developing and facilitating more innovative approaches, which is where the work on tobacco endgame also landed. And these are to be implemented by several countries. So it's always a consortium of EU member states and associated partners. Usually there are most of the consortium partners are national public health authorities who are nominated by these EU countries. So it's not a competitive grant, but this is by nomination of the EU countries. And there is always co-funding between the member states and the Commission. So this is in a general what type of project is the joint action. Now we are in the EU for Health program currently, which is the largest one by date. So altogether to all the different topics, it's 4.4 billion. And this is implemented by annual work programs where there are always the different types of grants and different types of priorities established. And these usually support the actions in these 4 themes that you see here. So they are the crisis preparedness and health promotion, disease prevention, health systems and healthcare workforce, and digital. And health promotion and disease prevention is of course the key in this field for us as well. There are several joint actions that have and are currently addressing tobacco control, prevention, and/or cessation. 2 are at the moment ongoing, so I just put these here. So in case you are interested, you can visit the websites or ask later on about these. So the Joint Action Prevent NCD, this is a huge project overall on NCDs, but it also has a lot of work on improving the implementation of effective tobacco control regulations. It has also pilots on smoke-free environments and cessation, for example, and some work also on preventing the industry interference, supporting the FCTC Article 5.3 monitoring in the countries in this region. So this is also very relevant for tobacco control at the moment. And as said, it's a very huge one. Joint action on chronic respiratory diseases is also ongoing. This is a smaller one, but there are also work on cessation and also training materials for healthcare professionals, for example. So that's the second one, which is ongoing at the moment. And the one which already ended around a year ago, Joint Action on Tobacco Control, was really focused on the regulations and improving the implementation of the TPD. But this one also had a specific work package on tobacco endgame. And this is what I will be talking about in the next slides. So moving on to this project where I led the Endgame work package. You see our name here. It was best practices to develop an effective and comprehensive tobacco Endgame strategy. When we started this work in 2021, the Europe Speeding Cancer Plan had just been established, and the Europe Speeding Cancer Plan does include this tobacco endgame goal for the whole region. It is defined in this plan as less than 5% of the population using tobacco by 2040, but it is named as a tobacco-free generation. And of course, sometimes creates a bit of confusion because usually tobacco-free generation refers to these generational sales bans measures. But in the EU Cancer Plan, it is really only the name of the policy, and the definition is quite similar to the definitions that are used in many countries. So aiming for the minimal level of tobacco use by certain time frame. When this was established in the EU, the situation wasn't really good. So the current smoking prevalence was around 25%, and compared to many other WHO regions in the EU region or the European region, the decline in smoking prevalence has been relatively slow. So definitely quite a challenging and ambitious goal for this region, considering the current situation with the prevalence. It had this implementation roadmap where there were several lines of actions, including the revisions of the key directives that harmonize many regulatory aspects in the EU, and then also the revision of the Council recommendation on smoke-free environments, enforcement of EU laws, and full implementation of the FCTC. But it also included a specific mention of a joint action to strengthen the cooperation on tobacco control between interested member states and Commission. What we can say now at these points, there unfortunately hasn't been much progress in the actual revisions of these directives, as many of you might know. Only the taxation directive has now been put forward with the proposed revision mid-July, and the Council recommendation on smoke-free environments, this was finally updated in the end of last year. But we are very happy that the joint action realized, and we were able to work with the Tobacco Endgame with a very nice group of partners from altogether 16 countries. Most were from the EU, so the EU member states, and then we also had Norway and Serbia there as well as partners. And altogether 22 organizations, mostly the national authorities or public health institutions, but also some universities in this group. Here you see the objectives, what we were tasked to do in this work package. Firstly, to identify and assess tobacco endgame strategies and forward-looking tobacco control policies for the European region. And this set included identifying and mapping forward-looking tobacco control policies and tobacco endgame strategies, assessing the inclusion of cessation support in these policies and strategies, synthesizing the available evidence, identifying needs for future research, and assessing the feasibility of their translation into the development of national policies and strategies. The second line of action was to explore best practices in the development. Okay, this is moving by itself. To explore best practices in the development, implementation, and evaluation of tobacco endgame strategies and forward-looking tobacco control policies. So this was really focused more on taking the next steps and really exploring these best practices and identifying the typical enablers and constraints in these processes. And the last line of action was to promote these best practices and facilitate the development of national strategies in synergy with other work packages, especially the sustainability one, which was the first work package 4. So this included defining and introducing the concepts of forward-looking tobacco control policies and tobacco endgame, and disseminating and promoting best practices in this area. And I had very, very nice co-leads from different countries and organizations. So I had the National Institute of Public Health from Slovenia, also the Norwegian Institute of Public Health, and then the Institute of Public Health of Serbia as well. Over the period of this project, we included and utilized a lot of different working methods. We started with a workshop to really gather some insight for us on what are the current challenges and what are the ways forward among different stakeholders that would be used to guide the work. And this was also used Okay, this is moving. Used to also develop our own framework for this work package, where we wanted to focus in this big group of partners. We also developed an indicator compendium to compile all our different methods. That's also available on the website of the project if you're interested in that. We also did an assessment of current tobacco control status using the FCTC and Empower data. We conducted a questionnaire data collection to regulators. This is the FCTC focal points, and got responses from 24 European countries. We had expert interviews in 8 countries to really focus on the challenges and enablers. We conducted a literature review, synthesis of evidence, and we also organized different webinars and collaborated in different guidance documents as well. And the publications are on the orange line below. So we have internal project reports, which are also available on the website. But we had a very, very nice group working in this work package who also wanted to publish scientific articles. So even though this is not a research project as such, we were able to then also develop several manuscripts and publish the work also to a wider audience through that. We had conference, webinar presentations, and lastly also developed this online toolkit, which I will be showing in the end as well. So here are just the articles and publications that we have already published from this work package. So we had the tobacco endgame, the WHO European region feasibility assessment, tobacco end bay goals and measures in Europe, current status and future directions assessment, and then also this narrative review that we conducted, compiling the evidence and also looking at the national strategies. We still have one manuscript in review, and we hope to be able to publish that soon. That is about the expert interviews in these 8 countries that I mentioned. I will be now moving on to the key findings and summaries, summarizing the work that we did in the different lines of action, and this will be based on the articles that you see here and all the other reports that we have already published. To start with the mapping, here you see an overview of the situation that was for last year when we ended the project. And what you can see here is that actually if you look at the distribution of the countries and measures or the strategies in Europe, it can be a little bit surprising how many countries actually already have these official tobacco endgame goals in the European regions. Several of these countries that already have the official goals, they have clear definitions of the set level where they aim for the smoking prevalence or tobacco use prevalence, or even the tobacco and nicotine use prevalence. So there is a quite a bit of variation there, what type of products these national strategies cover. There's also variation in the set timelines. There are some countries which already have their years when they want to achieve the tobacco endgame goals already this year. They are Sweden and Ireland. So these are going to be a very interesting case studies now, as it is quite clear that Ireland is not going to reach its goal here. So what are they going to do next? Are they going to do a revised strategy? That will be very interesting to follow. Sweden is going to meet this smoking prevalence goal, but as many of you probably know, Of course, they have more prevalence on the smokeless products, so it will be also very interesting to see whether they kind of live and consider their strategy now as achieved, or whether they also want to develop this further in the future. Then there are also countries that have stretched the timeline until 2040. Which is the same year as for this EU Cancer Plans definition, so 2040. This is, for example, the Netherlands. When we did the questionnaire, we also found out that actually in quite many countries, this was 6 at the time, there are already some relevant proposals for tobacco endgame strategies, for instance, from research entities or even within the governments, but these have not yet progressed. There are some that you see with the orange color here on the map as well. These are the ones where there was information publicly available, but then there were also some respondents to the questionnaire where they were sharing that this was being processed or proposed, but it was not yet publicly available. So these kind of countries we, of course, did not name in order to not expose them to any unnecessary industry interference in their planning for these strategies. But as for the sort of most ambitious goals that we see in Europe, there are 2 countries where the national goals include both tobacco and nicotine use. So these are Finland and Slovenia. In Finland, the goal is by 2030, and Slovenia, it is by 2040. We also, when reviewing the evidence and the national strategies, looked at whether these also include cessation support and how it's been integrated to these national strategies. And we found out that there was quite a strong emphasis in these national strategies, but it was really not linked to the measures that were specific to endgame. So clearly this was an area for further development and improvement in any national tobacco endgame strategies. We also found that vulnerable groups were quite commonly mentioned in these strategy documents, but again, the adoption of measures was quite rare. So to really have these measures as part of the strategies that would aim to reduce tobacco use in these groups. And in connection to this, in collaboration with one other work package, we also participated to these good practice statements for the treatment of nicotine dependence. So this is just shown here if you are interested in looking more of this topic. As part of the evidence summary, as many of you probably are very familiar with in the review of the forward-looking tobacco control measures, the prior scientific literature shows that there is most evidence on these product-focused measures, like the very low nicotine content cigarettes, and some evidence for supply-focused policies. But for many of these measures, the regulators still have to face quite uncertain evidence base, clearly less available evidence, and some more uncertainty also in the effects of the different measures. When we were looking at the feasibility of the different types of measures, we also found that actually there's still quite a lot of variation in the implementation of the FCTC measures in the European region. And this is also clearly something that can really challenge or hamper the feasibility of adopting these forward-looking measures. If these are not yet well implemented or in place, it can create a lot of challenges also in moving forward with these more innovative measures. And as part of this work, we also started to look at the potential of using the regulatory impact assessment as a tool to really identify feasible policy options for very different tobacco control contexts that we had also in the partner group. And this is something that we will be also looking more as part of the new joint action. Here are some examples of the innovative and forward-looking measures that we gathered during this project and what were at that time processing in these countries or already adopted. And what we can see here is that most of the measures in European context were focusing really on reductions in the availability. And there were retailer reduction measures starting to be implemented, for instance, in the Netherlands, where they're doing this stepwise reduction in the types of the retail outlets that are allowed to sell tobacco and later on also e-cigarettes. And Belgium had also similar stepwise reductions there. Many countries were already extending the regulations that are common to all as part of the Tobacco Products Directive, especially addressing the appeal of the products, for instance, implementing flavor bans also in other products which are not yet under the flavor ban of the Tobacco Product Directive itself, and also extending the regulations to new nicotine products, for examples. The age of sales regulations was also something where there was clearly some movement based on the questionnaire, for example. Increasing the legal age of sales to 20 or 21 years was something that was starting to move at this time. In Latvia, this had already been implemented, and in Ireland, this was then just about to be agreed and adopted, and now this is already moved forward, raising the age of sales to 21 years. This generational ban on the sale of tobacco, this is something that has been on the news a lot, and this is also moving forward at the moment. So this is something very interesting to follow, how this proceeds and whether this will be finalized. And in the Netherlands, after we have ended the project in the Netherlands, there's also been a similar proposal, which is also processing now, but hasn't really got us a green light yet, if I've understood at the moment the current status correct. What we saw in this mapping of the current measures and going through the responses from the questionnaire, we noticed that there aren't yet much adopted or even planned measures that would really focus on gradually phasing out the combustibles, really tapping on the addictiveness of the products and on the industry profits. And that's, of course, quite problematic for the industry profits, especially as allowing the industry to still gain a lot of profits enables them to also have large resources to also lobby against any innovative measures or tobacco endgame measures, and of course against any basic FCTC measures as well, or even delay the process. So that's clearly a challenge that should be should be addressed better. And in connection to this, the countries in this region, while they in many cases acknowledge the Article 5.3, its importance, and implementing it in principle, many of these countries still lack concrete tools to really take action if there is some evidence on the industry interference, and really have these protective concrete measures in place. So that was also something that we found and wanted to also bring forward as a clear challenge in connection to the tobacco endgame measures. When we ask the regulators and the experts about the perceived challenges and enablers, we also found very concrete topics that they raised, and they were slightly different depending on whether the countries already had these official national goals, or whether they were quite far from establishing these. Countries that already had these official goals were perceiving challenges, especially in relation to these non-combustible and new nicotine products, how to regulate them, how to address them as part of the tobacco endgame strategy, and as part of the measures that are needed to achieve these goals. Cross-border marketing was also raised as a challenge. High population group differences, very high smoking prevalence still in some population groups was pointed out as a challenge. Challenges in estimating the impact of the measures and sustaining the political will, which had been there in order to be able to establish the national tobacco endgame strategy. So that was also seen as a challenge to how to really keep this political will going on when the governments change and the political priorities change. Countries that did not yet have these goals also mentioned the lack of political will. So they didn't see it feasible to get this to the political agenda because of the lack of this will. They were mentioning also challenges with existing regulations, getting these regulations strengthened or improving their enforcement or implementation. And also in this group, the current high prevalence was seen as a challenge for this establishment of the national endgame strategy. But in both these groups, industry interference was mentioned as a clear challenge. But for the positive side, they were also mentioning several enablers. For example, establishment of a binding endgame goal was seen as a key element to really support the implementation of any innovative measures, and also keep this political will going on. Previous governmental prevalence reduction goals that were established in a cross-cutting way were also seen as beneficial for laying the ground for these more ambitious national strategies. Existence of active and effective civil society organizations was seen important and was seen as a clear enabler in these countries, and structural well-functioning coordination and commitment of the key individuals and organizations was seen as a clear enabler. For example, politicians in key roles was seen important to be able to get tobacco endgame strategies on the political agenda. The role of international tobacco control regulations was also seen as enablers. especially the EU regulations, if they are revised and strong enough, they were seen as beneficial also for the national tobacco endgame strategies. So on the left side, there were the enablers that we found when having the questionnaire and having the interviews among the experts and the regulations. And then on the right-hand side, there are also some enablers that in our consortium, in the partner group, were also seen as potential enablers. So in this group, we also wanted to emphasize the role of knowledge sharing and collaboration to really facilitate the dissemination of measures that can be seen as having a substantial expected impact, really leveraging the public support. In many cases, in many countries, there actually is very strong public support for tobacco endgame strategies and these forward-looking tobacco control measures, but this public support is not yet utilized as well as it could be. Utilizing the windows of opportunity, also in connection to this change of political priorities, was seen important, that the actors are really well prepared when these windows of opportunity arise. One aspect was also critically assessing the presented policy options, for example, in countries where there is not yet a proposal for a tobacco endgame strategy, or whether there are not strong policy proposals, really providing the critical assessments on this was also seen beneficial for the process to really start to call for stronger measures and stronger strategies as well. And also preparing for critical risks and the industry-driven distraction was seen really important in this partner group. So these were the enablers that also the group wanted to emphasize, in addition to what we found from the questionnaire and from the interviews. So in order to really facilitate also and disseminate information of the tobacco endgame strategies and forward-looking tobacco control measures in this work package, we also wanted to put together materials that are easily available for different audiences. And here is the example of the policy brief that we developed, and which is also available in several languages in our online toolkit, which was the last deliverable in this project language, last deliverable of this work package. And here you also see the QR code if you want to visit that tobaccoendgametoolkit.eu. This toolkit was developed with our partners in this work package to really serve different target groups, regulators, policymakers, researchers, civil society organizations who are interested in this concept but don't necessarily know it very well yet. And also we wanted to showcase some different country approaches to tobacco endgame strategies and also finding the feasible policy options in this field. This is developed for the European context, as it is a product of this specific project, but its contents may be beneficial in other regions as well. So I hope this is useful also for a quite wide audience. In this toolkit, there is information on the listed measures. So there are brief definitions and brief summaries of what these tobacco endgame goals and measures are. In Europe, there are materials that support identifying the feasible policy options. We have case studies from our partner countries showing potential best practices. And we've also put together some key considerations and common myths related, for instance, to the industry arguments. We address also monitoring and evaluation and provide a lot of useful sources for information. And from this, you can also quite easily find all our reports, articles, and webinar recordings if you are interested in learning more. But this is also then just to show that this, what is feasible in this field for the different countries, even in the European region, is very, very context dependent. And this is from the latest Eurobarometer study, which gathers information of the use of tobacco products and current smoking in the European region, in the EU countries. And on the orange line, you see the EU cancer plan's goal of less than 5%. And it is very far from most of the countries still. And even the EU average is still at around 24%. So not much improvement from the situation which was when we started the project. So the decline is very, very slow in the EU region, and is clearly one challenge for this region. But on the lighter blue color, you also see where the countries that have these official tobacco endgame goals are. So you see that even in this group, there is still quite a lot of variance in the smoking prevalence alone. So for example, France was still at 27% of current smoking prevalence, so even higher than the EU average when this Eurobarometer data was collected. And then again, Sweden and Netherlands are already quite close to the EU goal level. So a lot of variation also in this group that already have the national tobacco endgame strategies. In the toolkits and as part of the dissemination work of this work package, we have wanted to emphasize that there are two complementary ways so that these are not exclusive. If it's not possible to establish a national tobacco endgame strategy, it is still possible to move forward these forward-looking tobacco control measures as individual policies. So it can be both of these, or it can be also the individual measures if there is no political will for the national strategy development. For the EU context, we also laid out some different policy options that can help countries in this region to find the feasible ways for them to start taking steps as part of this process. So for the countries that are not at the moment having a strong FCTC implementation, that still have to improve the implementation of some of the core measures like the taxation, for example. This is the feasible starting point for them. And these are the measures that are really reflected in the best buys. So there is a lot of evidence, a lot of supporting information for these available. And this is the feasible starting point for several countries in order to move this whole region closer to the EU's tobacco-free generation goal. And the EU Cancer Plan goal can also in these countries be utilized to really call for strengthened measures, strengthened FCTC implementation, if not yet to call for any tobacco endgame strategies or forward-looking tobacco control measures. But in these countries, if it's already possible to advocate for a national tobacco endgame goal and strategy, the simple approach for these countries would be to align it with this EU goal definition and timeline, as it is a really good reference document and reference goal for several countries in this region. Then for the countries that already have good implementation, some advanced measures like plain packaging in place. For these countries, it is likely more feasible for already advocate for forward-looking measures or even a national tobacco endgame strategy and goal. Again, here, simple approach could be to align with this EU goal. And another option that also was raised among our partners would be to really look at the goals of the relevant comparison countries. Politicians are often very interested in what is happening in neighboring countries. So some countries that are close to the country context and already have this national tobacco endgame goal would be really, really good relevant comparison countries when advocating for a new national tobacco endgame goal. In some cases, like for example in Sweden, the tobacco endgame goal actually initiated as a civil society movement, and this was then later on acknowledged by the government as part of their national strategy on substance use. So this can also be one feasible way to move the tobacco endgame strategies forward and get these on the political agenda as well. Then, as shown in the map in this region, there are already quite many countries that have these national tobacco endgame goals. For these countries, there's still actually quite a lot to do. Starting with the FCTC implementation, these countries include also many countries that are not yet implementing these at the highest level. So this would be also relevant for many of these countries, and then advocating for these individual forward-looking tobacco control measures that are considered feasible in this local context. For these countries, also monitoring and evaluating the progress regularly, using this information to develop and propose new actions, new policy measures would be very useful. Assessing whether the national goal and the measures actually sufficiently address the increasing product portfolio of the industry. As shown in the map, quite many countries operate with smoke-free goals or smoke-free definitions. So it is relevant for many countries to also consider whether this is sufficient, especially in the future when we consider the continuous entry of the new products on the market. And very importantly, to really share information about the goals and measures, so that the other countries in the region and also outside the region can really identify your country as a relevant comparison, are able to find the information easily, are able to contact the relevant persons easily in order to really exchange the information and learn from the experiences in these countries. For all countries, there are also some elements that are common and important for all the countries, regardless of their status with the tobacco endgame strategies and the strength of the FCTC implementation. And these are the multi-sectoral and multi-country collaboration, encouragement of that, as well as the civil society advocacy to really network, really exchange information, and provide or receive technical assistance. Preventing nicotine addiction. This is becoming increasingly important. Of course, it's always been important, but it's becoming increasingly important when the industry product portfolio is being developed more and more into these smoke-free, tobacco-free nicotine products that are often very attractive to younger populations, and also marketed heavily in social media platforms and so forth. So utilizing this FCTC Article 5.2b, which really obligates countries to adopt effective measures also to prevent nicotine addiction is important. Integrating effective cessation support to these tobacco endgame goals and forward-looking measures, if these are adopted and implemented. As I mentioned earlier, this is often mentioned as an important element in the national strategies, but still this needs more investment and more concrete action, also more support available in order to balance the more restrictive regulations and the forward-looking tobacco control measures. Strictly adhering to Article 5.3 and scrutinizing the industry-driven harm reduction initiatives. This came up both as part of our partner group and then as part of the questionnaire and interview participants, that this has been causing a lot of distraction among the regulation, which then again delays the whole progress with tobacco control and tobacco endgame measures. So this is something where the regulators need to be really careful with, and this is an area where also the civil society and the researchers also need to support the regulators when they are facing these industry claims or initiatives. But as last, in the EU, the directives are key elements, key structures where it is possible to really move forward more ambitious measures. And as I mentioned in the beginning, unfortunately, there has been a lot of delays in the revisions of these directives. They have become quite outdated, not being able to address the challenges in connection, especially to these new nicotine products. So really updating, revising these directives regularly and really integrating some forward-looking elements into these revisions is something that can really drive the progress in this region and really help the countries move forward in their own national strategies and integrate tobacco endgame in the national strategies, and then move forward in this whole EU Cancer Plan, the regional goal as well. And now that these smoke-free environment recommendations has been finally updated, implementing these is also something that's very important for the countries in this region. Okay, that was a quick summary of the work that we did over the years in the joint action and the tobacco endgame work package. So now on my last slide, I will just briefly mention the plans that we have now for this new joint action, where we are planning to expand the work that we did as part of the GATC2. And this is something where I was hoping I would be able to tell a little bit more at this moment, but this project is still in a preparatory stages, hoping that this will start around November, December this year. But this new joint action overall is going to focus on the health promotion and smoke and aerosol-free environments. And as part of this, there will be work on forward-looking tobacco control measures. We are in this group planning to utilize a lot the FCTC Article 2.1 expert group report, which is coming for the COP11, which is in Geneva in November. This report will be utilized in this work to take it to a scrutiny with our partner group to really start to look at these measures as part of feasibility assessments. So in these reports, this will provide a lot of the evidence base, but what we are going to do in this new joint action is to really start to look at the practical aspects, implementation. So this will be one line of action, the feasibility assessments of the forward-looking tobacco control measures. And as for the evidence, it has come up in several occasions that actually at the moment there isn't much research, much evidence of the impacts of these forward-looking tobacco control measures or the expected impact in the European context. So as part of this new joint action, we are also planning to conduct a modeling study to strengthen the evidence base also in this European context. I'm hoping to be able to talk about this more in some other occasion, and please feel free to contact me if you are interested more in this. But at this moment, this is what I can tell about the new upcoming work. But I'm very happy that we are able to continue with what we started in this joint action on tobacco control too, and I'm sure there will be some relevant outcomes also from this work once we get it started. This was my presentation today. Thank you very much for listening, and if you have any questions, I'd be happy to answer, and please feel free to contact me also later on. Thank you very much.
Okay, thanks so much, Hanna. And I want to also say thank you also for getting up so early in the morning so that you could come talk to us during our daytime. So I do have a couple of questions from people in the audience. So one of the questions about the Endgame goals in the different countries in Europe. So do the Endgame definitions for each country include all populations, so all the populations within the country, or is it just an overall population goal for the countries? Do any have differential goals and so on?
Yeah, that's a good question. So most of the European definitions have general population goals, but some also address some specific, mostly young population groups. For example, in the Netherlands, they have goals for young people included as part of their main goal. And then, for example, in France, they also address the pregnant women. So there are some specific groups mentioned, but usually it is for the main population group.
And there's another question about, I guess, those other non-therapeutic nicotine products, about whether the EU smoke-free generation goal also includes those in the goal, or is it just focused on smoking prevalence?
There was a bit of break, but I understood you were asking about the smoke-free or tobacco-free in the EU goal.
So
Yeah,
the
right.
smoke-free generation goal for the European Union, does that include just smoked tobacco, that 5% by 2040 goal, or does that also include other products as well?
Yeah. So for the EU tobacco-free generation goal, it is really about tobacco use. So it's not a smoke-free goal, it is a tobacco. So that would be the starting point. But for the individual countries in this region, there are two already, which also include these consumer nicotine products as part of their goals. But this is not on the EU level. These are in the
They're the
individual
national
country
goals.
strategies. Yes, yes.
Okay. Now we're just on the hour, but if you can stick around for a few more minutes, I've got some questions I wanted to put to you.
Yeah,
So
that's fine.
I was interested in you talking about like you've asked the experts and so on about enablers and barriers, and I was wondering if the TPD came up as a barrier about some particular endgame policies, like your very low nicotine content standard or banning filter tips on cigarettes and so on, if that was discussed much.
Yeah, so mostly the international level and the EU regulation were perceived as enablers. So it was seen important that these are revised regularly, and it's kind of up to date with all the product developments. But yeah, in some more ambitious countries, there have also been cases where these tobacco products directive is also caused some challenges if the countries have wanted to move forward with some more ambitious measures or taking some of their policies beyond what is strictly in the TPD. And yeah, it has created a delay in the process on the national level, and a bit of confusion sometimes what can be done on the national level and what is really on the EU level. So definitely it has both sides there.
And so related to that, I guess, is around the, Article 2.1, the forward-looking measures and so on, that establishes that the FCTC is a floor, not a ceiling, and that parties are encouraged to go beyond what's in the FCTC. Is there any discussion or thoughts around, the TPD in terms of that it should be rethought of or reimagined as being more like a floor rather than what seems to be like a standard across that also provides a bit of a ceiling as well?
Mm. Yeah, well, I'm hoping that as this joint actions process and there is more discussion, more awareness raising also of the EU goal, this type of thinking would become more prevalent. I think at the moment the challenge there is that the TPD, for instance, and also the tobacco advertising directive. Are so old. So I think many are already just waiting for the next revision. So I think that is the priority for many, that just make the revision so that it is up to date with the product developments and can really actually help countries to move forward with their own measures as well. Then integrating the 2.1 thinking, the forward-looking tobacco control thinking, and this floor to ceiling thinking. I think that is the next step there, but definitely something that I hope that the many countries also use their available resources to really raise awareness that this could be the case, and that at least it shouldn't be any kind of barrier if the individual countries want to take some more ambitious measures as part of their own activities. Long answer, but I think this is we could talk about this for a long time.
Yeah. This
Yeah.
is one of those. It's a bigger
Yeah.
topic, and I guess also just there have been some really exciting policies that have been implemented in, say, like the Netherlands and Belgium and so on, like moving towards phasing out tobacco retailing through different group types of retailers and things like that. So we're really interested in watching what happens there and the evidence that comes out of that as well. So with that, I'll wrap up, and I'd like to thank you so much for joining us again, Hanna, and for everyone who's come to listen in today. And also we will have the video available for people who weren't able to make it today to watch later. Okay, thank you.
Thank you very much.